everybody to our 8th webinar sponsored by Disability Voices United. We're getting started right now and we're going to allow the participants to join us for the next 1 minute, but we thank you for joining. Want to remind everybody that you'll get information in the chat as you join, and that those of you who need Spanish translation, we are making that available on an outside line. Some people will have been asking us, why do you make that available on an outside line? And it's because we have found it to be the most effective way to get this information to the most people, since many people, not all people have computers, which allows them to do the simultaneous translation on Zoom. It also, it just creates, I was on a meeting the other night where it created a lot of problems. So we have found this to work successfully. So at this time, I'd like to ask our wonderful interpreter, Lorna, to speak on this line in Spanish and explain how people can join the Spanish translation. Go ahead, Lorna.
Para las personas que hablan español, para escuchar la interpretación simultánea del español, pueden llamar al 515-604-9835, de nuevo, 515-604-9835, y luego agregar el código de acceso 245-384 y el símbolo de número después. El código de acceso, de nuevo, es 245-384 y el símbolo de número. Muchas gracias.
Thank you, Lorna. I want to remind everybody that if you have questions today for any of our panelists, that you should put that in the Q&A. The Q&A is available at the bottom of your screen. It actually says Q&A with 2 little voice boxes. And that is a way that we can track your questions. If you put them in the chat goes very, very quickly and we lose your questions. So please put all your questions in the Q&A. It also allows all of our panelists to look at the Q&A and to answer them in real time, in addition to answering them with their voice. So welcome everybody. Disability Voices United is an organization directed by and for people with developmental disabilities and family members. We were founded out of the self-determination law that a number of our founders got passed in 2013. It has been a long road to get this law implemented, but it is being implemented right now. This particular webinar is going to be recorded. So those of you who can't stay for the entire webinar, you can find the recording on our Disability Voices United website. And I am going to share with you, hold on one momento. I'm going to share with you information so that you can see all of what we're doing. So hold on one moment. I'm going to share screen. You will see that we have a coronavirus resources website for the disability community. It is disabilityvoicesunited.org/CV. All of the previous webinars are on that website, as well as a range of information. We update it daily, sometimes more than once a day, as information is given to us. We are also doing a survey of people with all disabilities and family members, where we're looking at their ability to access things like special education, regional center resources, other kinds of public benefits, and PPE and whatever people need for to survive this coronavirus pandemic. That survey is going to close on May 12th because next week's webinar is going to release the final survey results. Speaking of our next webinar, my staff does not even know this. The date has been determined. It's going to be on Friday, May 15th at 2 p.m. Friday, May 15th, 1 week from today, an hour later, where we'll be discussing 2 things. Number 1, the results of our survey, as well as the survey of the State Council on Developmental Disabilities, which has looked at similar issues in a different way. We will also be discussing the budget that will have come out the day before on May 14th. It's not the final budget, but it is some indication of how bad things are going to get, as we're expecting billions and billions of dollars to be cut in the state of California's budget. Two more quick announcements. We are doing focus groups on supported decision making. You can find information on that by joining our mailing list or looking at our Facebook page. Our mailing list is, you can join it by going to tinyurl.com/join-dvumail. So that is all the announcements I have. And now we are going to get started with our webinar. And I want to thank all of our wonderful participants for joining us. We want to start with Jim Knight, who's the Deputy Director of the Department of Developmental Services. Jim has been an incredible support for our community to get the self-determination law implemented over the past 6 years. We've become really close with him, all of us at DVU, and actually really love and admire you, Jim. So I want to thank you. Jim, we're also asking you to speak not just on self-determination in this coronavirus time, but also to talk about the expansion of participant-directed services in the regional center, because it's similar. It's not as free as self-determination, but it does provide a lot of choice and control. So thank you. Go ahead, Jim.
Thank you, Judy, and to others with Disability Voices United for putting this webinar on, and really appreciate the invitation. And also want to echo the many years that we have put in together in working through this, and appreciate your continued support for this and for us, and as we work through this. And to everyone who's participating, I hope that you all are staying safe and able to work through this. And one of the things that I wanted to start with regional centers, and I know we're talking about self-determination, but to start with, one of the first things that we recognized when things were beginning to, quote, close, is that we needed to provide some flexibilities for the way services are provided, and in addition to who can provide those services. What's that sound like? Sounds a lot like self-determination, right? So we really had to really think differently. And that the reason I want to bring that up is because that's what self-determination is. It's thinking differently. So in many ways, self-determination gave us kind of a jump start, if you will, and gives you all a jump start in being able to react to different situations. It gives some flexibility that you didn't have to wait for the department or the regional center or others to give you. And so when we talked about flexibility, like I said, we were able to allow for services to be provided electronically, either remotely through Zoom, such as this, in different locations. Those are things that already can happen within self-determination. So it's something that I really wanted that while we talk about things being closed, self-determination is open. So please go forward with that. This is the time to actually do that. One of the things that Judy, now we do recognize that there are still some things that we need to give some flexibility within self-determination. I know we've heard about that, is that with background checks. Some folks need to get a background check, which requires getting fingerprints. And we know that access to where fingerprint locations is limited at this time. Now we are working to be able to do something around that in that area. Some of you may be aware that the in-home supportive services program and others have been able to modify the way those background checks are done and don't require a fingerprint. This is something that we as a department aren't able to do on our own, so we are working with others, the governor as well as others, to be able to give some similar flexibilities within the self-determination program so that people can continue and hire folks and move forward. So I don't have a date for that yet or exactly what it's going to look like, but do know that we are working towards that. Judy mentioned participant directed, and just for a bit of a background, even kind of almost as well, before this program launched, there were still some services, and there still are some services within the regional center system that people can direct on their own. And by that, I mean that folks can be the employer and hire their own people to provide certain services. And before the pandemic, that was limited to typically respite, sometimes transportation, and a couple of others. But one of the things that we recognized, especially during this time, is that some of those flexibilities, is we wanted to expand that. So even for folks who aren't in self-determination, to, if they knew someone who was able to provide some services for them, that they could direct those on their own, still be the employer, work through a financial management service, have the same kind of flexibility that you have in self-determination. It's not a budget and it's a limited amount of services, but still we wanted to expand those services and the availability of those. And so that would include services that you're typically referred to as personal assistance, independent living, and supported employment, because we certainly didn't want folks that if their jobs were still available, yet they didn't have someone to support them through their typical supported employment agency, if you will. We wanted people to be able to again, access those jobs and be able to get support in doing that. So we did recognize, again, so if you think about self-determination, allowing flexibility, not only do we want to promote self-determination, but we actually expanded it to folks who weren't in self-determination, recognizing that this is a really great way to be able to do some things in a flexible way and to be able to pivot, which this pandemic obviously has required all of us to do some pivoting and thinking differently. And so this is one of the areas that we wanted to do in that too, but to expand those services. So that's kind of at a high level, kind of where we are with DDS specific to self-determination and these participant directed. We also have a great deal of information on our website too. And Judy, I don't know if you'll be able to share that with the participants as well in the chat. If you want to go, there's a number of directives and other flexibilities that we've given, as well as other resources for folks too. So I do have a couple minutes for questions if you have some, but I am going to have to get off fairly quickly.
Thank you so much. So let's just spend a couple minutes. So as we've heard, yes, it seems like the biggest barrier right now is the background checks. So what would be your advice to participants like my own son, who's kind of ready to launch, but is just waiting for that? Should we have everything lined up, ready to go? What would you suggest for us?
Yeah, certainly. I mean, you know, anything that you can do concurrently while you're waiting for other stuff, that's absolutely what you want to do. Get as much as you can in place and be ready to go. You know, you don't want to just wait for things step by step. I mean, do things as you can. Get in the budget, the spending plan, all the agreements that you have to do with people that you want to work with. Absolutely do those as much as you can.
Great. Couple more questions are coming in. This is about participant-directed services. They're asking if it includes nursing, and can participants hire their friends or family under participant? These are two separate questions. So first, let's ask, does this include nursing?
Yeah, so nursing was already included, so that was not something that we had to offer additionally. So yes, nursing is available.
Right. Can participants hire their friends and family under participant-directed services?
Yes, well, if they're qualified for the most part. And so in our directive, we did talk about there's certain, like for, if your friend's not a nurse, obviously you can't hire that person.
Or for any service.
Right, yes, but, and so I don't have them all memorized, which ones are available for family and the like, but I can send those to you. But for the most part, yes, family are able to provide those services.
Yeah, my memory is that parents were the ones that were prohibited with the exception of supported employment.
I believe, yeah, I'll double check that.
Spouses are allowed to provide that particular service.
Mm-hmm.
A couple more questions. How are background checks being done for participant-directed employees?
So those are not specifically required for those participant-directed services.
Okay. Okay, great. Here's a question. Will participant-directed services be available beyond the COVID-19? So, as you said, they have been in existence for many, many years. It was just a few services got added. So maybe you should reiterate that.
Yeah, that's some services were added specifically due to COVID-19, and there's some other flexibilities, like I talked about, the ability to provide services remotely or electronically and the like. And so we're taking the opportunity to learn from, hey, are some of these things, do we want to carry them on even after COVID? And so we're definitely going to be looking at that as a you know, we've got to take advantage when we can of these learning opportunities. And this is something that we've had a lot of positive feedback in some of the things that we've been able to do.
Sorry, that's me, and I'm going to turn off my phone. Thank you. Okay, you have a million questions. I'm going to just ask you
Yeah.
a few more because I know that you have to go soon. Um, this is a question on self-determination. If a participant doesn't agree with the budget, the individual budget amount that they have gotten from their regional center, what can they do about that?
Certainly, I mean, we want to be the first step to find out why and work with the regional center to have some explanation as to what went into that budget and how they got to that number, and to try and work through that. And I think the regional centers will want to do that at that kind of lowest level if you can. Ultimately, though, if there's not agreement with that, there are other opportunities and more formal opportunities to file even a fair hearing if necessary to do that, but hopefully it won't get to that point.
Here's a whole bunch of questions around participant-directed services. Does the family member have to live in the same home to be hired by the participant? Does a family how does a family even ask for it? What do they ask for with their regional center? Just kind of general stuff like that.
Yeah, so there's no specifications about where that family member or whoever provides the support is living. So yes, they don't have to live with the individual. And as with all services that are available through the regional center, is to work through the regional center to make that decision or choice known that this is something that you're interested in, and they can help support that. And Judy, I've got time for one more. I'm
okay, one more.
Yeah.
Let's see. There's some of them are the same. I'm wondering, so this person's just wondering why parents and spouses are excluded from providing personal assistance during the pandemic. Do you know why that is?
There are some actually, yeah, there's some federal requirements about in whether it's self-determination or otherwise about who can provide particular services. So we do have to be mindful of that even in the self-determination program as well.
Okay. Well, thank you so much, Jim. We're going to try to get some of these other questions answered by some of our other experts here on our webinar. But we really thank you for all of your help, and please get us those background checks as soon as possible, and let us know if we can like lobby the governor to make this happen, because we're good at getting lots of calls in if we need to. So
that's great. I appreciate it, and sorry that I have to run so quickly, but really thank you again for the invitation.
All right, thank you, Jim. Take care.
Thanks.
Okay, we're going to move on now to the co-chairs of the Statewide Self-Determination Advisory Committee, who will explain what that is. Many of you on this call, I can see who the participants are. Many of you are members of your local advisory committees or chairs of your local advisory committees, so you might sit on the statewide committee. But right now I want to introduce Rick Wood and Maria Marquez, who are the co-chairs of that committee. I will unmute you both, or you will have to unmute yourselves so that you can speak. Maria, you need to unmute yourself, Maria. Go ahead, Rick.
All right.
Okay, you're good.
All right. I lost the picture, but hold on. Okay, can you hear me? All right. I want to thank everybody for being on this Zoom site. I know we can't see each other in person, and I miss those meetings when we see each other in person, but otherwise I'm glad that we're able to see a little bit of everybody. So I do want to say that I was the first participant in California to have my budget signed under self-determination. So now I'm on self-determination. I got picked in the second round of self-determination, which is great, but I'm at a standstill right now because I had even asked my regional center, well, what's going on with the self-determination? And they go, well, we're at a standstill. And I was like, oh, okay. And I did bring that up to Rick when me and Rick were talking the other day beforehand when we were talking about this meeting and what's going on, you know, with the different regional centers as well. But because I got information, now I'm going to call my service coordinator and say, you know, that because of the pandemic, we do need more help. Well, I know I need more help, and I'm home a lot more, and I've been working from home as well. But just those little extra things that I need help with, I am going to call my regional center and let them know that I need more help than what they're can provide for me, because they said that, oh, my support staff is only supposed to, because right now I'm working through an agency, I don't want to say the name, but they said, oh, well, they can only go see you 3 times a day for three times a week for 3 hours, and the rest of the time they have to call you. So I'm supposed to be on the phone for 8 hours or 5 hours, whatever they give me. That's kind of ridiculous, because more physically, I need more help to be lifting things when things fall on the floor, or just, when I need help with certain things that I need help with around the house. So I really think that that's not fair. So I wonder what people that are, that need more help, that need help feeding themselves or taking a shower and need assistance, or they need somebody 24/7, and they're telling the staff, oh, you can only go for a couple of hours. Is anybody else having that problem?
People can't necessarily respond to you, Maria. So go ahead and keep presenting you and Rick, and then we'll
Okay.
move forward, okay?
And so I want to say I'm excited once all my services are in place with the self-determination. So I'm just going to move forward and really push on their door to get assistance at this time. And, letting them know, what about my self-determination? And I know that I know my regional center, nobody's working at the office, and my service coordinator, she's supposed to call me every week because I did have bronchitis, so they were worried about that. But that happened like maybe a week before the pandemic started. Hello? Oh, okay. Sorry about that. I don't know what happened.
Okay.
But yeah, so that happened a week before the pandemic started, and I got worried. So I didn't have to go see my doctor, but I gave him all my symptoms, and then I looked it up, all my symptoms, and I knew it was bronchitis. So they gave me medicine and they mailed it to me, and within 3 days I was feeling much better, but I was really worried about that. So I will keep you guys posted on
We can still hear you, Maria.
on what's going on with my services, because I want to know myself.
Nope. Thank you, Maria.
Okay, you're welcome.
Rick?
And Rick?
Go ahead.
Yes, thanks, Judy, and thanks, Maria, for the benefit of everybody. I'll start with this. I am the parent of a now 25-year-old young man who was and continues to be a participant in the Kern Regional Center self-determination pilot, which was established now almost 21 years ago. And so he has been in self-determination and has been self-determined for just under 21 years. I am privileged to be one of the founding members of Disability Voices United, and have devoted the last 6 years since this law that was to expand self-determination was originally passed. It was in late 2013. It's been a long time. What I've learned from the pilot, which is very similar, not exactly, but very similar to the self-determination program as it currently exists, is that the participants, consumers and families, now have choice in the delivery, the types of services and supports that they're to receive, and therefore control over their lives. That simply doesn't exist under the traditional delivery method. So I think, as Jim Knight said, that one of the greatest benefits is of self-determination is the flexibility, and in particular, if something happens, such as a pandemic, in the middle of a year, the flexibility that the participants and families have to change their plans, to do things that they otherwise wouldn't have thought of doing before to replace services and supports that are not as readily available. As many people know, I'm a strong proponent of self-determination because it works. In Kern Regional Center, there were 36 people who volunteered to participate, and in a sense, they were pioneers. And over the course of this couple of decades, there have been no fair hearings. The quality of life, and most importantly, the degree or level of happiness of people has improved dramatically. And I would expect that to continue because all of the folks that were in self-determination have either in the pilot, have either become members or participants in the new program, or they are about to. So in the course of all of this, I, along with Maria, along with Judy Mark and others, have become members of the statewide advisory committee on self-determination, and it reports to the state council. And that may not mean anything except that in each regional center, there is a local advisory committee made up of folks that are either family members or consumers and others who have an interest in self-determination, who provide advice to the regional centers on the implementation of the law that was passed in 2013. Each of the chairs of those 21 committees is now a member of the statewide committee that then provides advice to the state council, that then advises the Department of Developmental Services. So what we have seen over all these years are a number of barriers, and I'll just point out a few. The first is that it has taken a long time since 2013 for this program to be put in place. We're now almost 2 years into the introductory part of it, and it's going to go statewide in a year. Therefore, the impacts on enthusiasm of those who might be interested are evident. It's simply taken a long time. This is a program that, going statewide, has been challenging to put into place in order to adhere to the principles of self-determination and at the same time put in place rules and structure that are required by the federal government and the state government, because after all, they're handing out the money. The second barrier is that what we've seen over the last nearly 2 years is inconsistent support and enthusiasm by the regional centers themselves. I think that it has a lot to do with the fact that it's a new program. In many instances, service coordinators are not adequately or well enough trained. Time, I think, will take care of that. In addition to that, we are training independent facilitators, we are hiring fiscal management services, and we are, most importantly, orienting or providing information for those who might be interested. It feels complicated, and in the end, it is. Pardon me, in the beginning it is, but in the end, those who get into the program and are on it realize that it's so very much better than the way that, for most people, I think, than the way that most of our developmentally disabled population experience. So we need more trainings, and the regional centers need to take the lead, because this is something that they are now charged with implementing. Additional delays have included in getting a budget for people. There have been a lot of questions about the budget. All those questions are answerable. But getting a budget first and getting it certified second, which is necessary before a plan can be put in place, is important, and it goes hand in hand with the person-centered planning process. We have only a few now FMSs, those are fiscal management services that manage the money of the participants in place in California, but there are several, and they have reached out statewide, and I expect that there will be more. And then finally, you know, we're in the age of COVID-19, and it's going to be with us for some time. We know that congregate settings have been impacted. We know that programs have been suspended. We know that services that were otherwise available are not available as readily, or maybe not even at all. And so the question is, you know, how does self-determination handle these kinds of challenges? Well, the way that we've handled them is the same way that we've done it for the last 2 decades, and that is we become creative in filling the time and the opportunities that become available with new events, with new activities, with the establishment of new and different relationships than existed that might be part of a person's plan. The great thing about it is the flexibility that is allowed for people to be creative. And what is it that we need to be creative about? It is being creative about having things that will impact the quality of the life of the participant and family. What does that translate to? It translates to happiness. It translates to quality of life. We're all entitled to the same thing. And so self-determination is not like the traditional delivery in that it in that the services and supports are prescribed and they either exist or they don't exist. The creativity is nearly endless in the things that can better or contribute to quality of life of the participants. That's really important now. And so Jim talked about, and Judy talked about background checks. We are experiencing a lot of delays in background checks, which are holding up plans. But I'm going to leave everybody who is either just now getting into self-determination or who is who wants to be self-determined and wants to participate in this program. I want to leave you with this. We're all pioneers. My family and my son were pioneers 20 years ago, as was Maria. But we, in this opening stage, we are all pioneers and we are going to learn from one another. And so I would encourage people to not give up. Yes, it takes time. It seems complicated. If a person in regional center appears to be putting up barriers to self-determination, try to break those barriers down by demanding progress on the implementation of your plan. We're going to do this one by one person at a time, one family at a time. Needless to say, in 1 year, it's going to be available to everybody. So I was full of hope 20 years ago when we were truly pioneers. There were no roads then. Now there's a few roads, but they're kind of dirt roads and a little bumpy. But I still have great hope that those who can take advantage of this are going to be happier. And the proof is in the pudding. No one from Kern Regional Center pilot has dropped out. No one. Everyone has transitioned or is transitioning into the new program.
Thank you so much, Rick. We're going to continue on. There's a lot of questions that you will be able to answer, Rick, but I want to get through all the, there are also a lot of the presenters will be able to answer these. So we're going to move on right now and give our audience an example of somebody who just got into self-determination in the last couple of weeks, even during this pandemic. And he is the first in his regional center to go in. So even though it's taken 6 years, they finally have won. So Howard McBroom is joining us. And he is also joined by his independent facilitator, Sunny Charnes. So I know that they are working together on their presentation. So go ahead, Howard and Sunny.
Good afternoon, Judy. My name is Howard McBroom, and I am a client of Lanterman Regional Center, as well as a self-determination participant who just got in the door. And we are going full speed ahead now. It has been a long journey, a long and hard journey. There were many obstacles along the way, and there was a lot of advocacy that was needed to overcome those obstacles. And one thing that really helped me was having such a great team of people to help me, like you and Jackie and Stephanie, my sugar coordinator, and Brian and others. I had a great team of people helping me, and I don't think I could have done it without them. But the biggest problem was the slowness, the sluggishness. to say that it proceeded at the speed of a tornado would be an understatement. And there were just so many things that had to be done. So many, frankly, I don't think the regional center really understood what was going on. They were reinventing the wheel from scratch, and it took them quite a while to learn how to do it. But we persevered, and finally, self-determination was implemented for me. And the benefits already are enormous. I am being able to get my novel typed now. I am being able to get my website improved and made professional. I am going to be working on many other things, such as a new hearing aid. And last but not least, being able to pay my wonderful independent facilitator, Shawnee. Judy, I can't say enough for her. I just cannot really say enough for her. And I can't tell you how grateful I am that she persevered in working with me, even when she was not being paid. But she was, and I am paying her now. So that is a really great piece of news. I feel really good about that, being able to pay the woman who helped me so much. And we are moving ahead. My novel, my hearing aid, my website, paying Shawnee, and we're also going to be able to use my self-determination resources to help me manage my health needs. My legs, there's some kind of nerve damage done in my legs. They don't know yet, but it rendered me almost incapable of walking. Even with a walker, I can just barely hobble along. I had an MRI scan today in my spinal cord to try and see if they can find out what is causing the kind of nerve deterioration. And I hope that will turn out some result. And if I do need some kind of healthcare treatment, I will at least have the self-determination financial resources to help me in it. And I hope and pray that the doctor can find out what is wrong with my leg, what kind of nerve damage it is, so they can fix it and I can walk again. And that's my report on self-determination.
Thank you, Howard.
Thanks, Howard. If I can, I'll have a few things to add. Is that all right? Hi, everyone. My name is Sunny Charnas. I'm the founder of an organization called Guidelight Group. I'm an independent facilitator, as well as an independent facilitator coach. And as Howard said, we have been working together for, it took a full year for him from the time that we started working together on his person-centered planning until the day that he actually started in the program. It was a full year. And so as Howard mentioned, there were barriers that we faced along the way, things that Rick mentioned and others have mentioned already, just the amount of time and advocacy that it took. As Howard stated, he is the first at his regional center to begin in self-determination. So that is really exciting. And I think he's the perfect person to be leading the way. But that also meant that each step of the way, every single thing that had to happen, it was the first time that it was being done. And so it just took an extremely long time and a lot of meetings and a tremendous amount of advocacy to get to this point. So that was the hard part. The good news is the current situation with the coronavirus and shelter in place didn't impact Howard in his ability to transition during this, within the last few weeks. And in general, what I'm seeing with my other clients is it isn't causing further delays other than the background checks. So that's promising. I'm still seeing this commitment to business happen. The other, really cool thing that I've seen, particularly with Howard, as a benefit to him being in self-determination during this time, is that we have been able to engage a whole person-centered planning team, a whole circle of support which is not only made up of service providers that are paid by the regional center. His team involves friends, members from his, a leader from his church, and other people who are involved in his life who, if he was in the traditional system, there wouldn't be this team approach of really keeping in touch everyone in a consistent way to make sure that there are plans in place and contingency plans, and that Howard's needs are being met. We met as a support team of all the people in Howard's life in the beginning of the shelter in place. And Howard mentioned that one of the things he was really missing was going to church. And because there's someone from his church on his team, we found out that they are live streaming services, and we were able to put a support in place to help Howard access that live stream. So just little things like that, that, you know, having the circle of support and having, frankly, someone there to coordinate all of that, I think has been a huge benefit to Howard in keeping as much normalcy to his life as possible during this time. And then, as Howard mentioned, we're moving forward with the other things in his plan, getting his website worked on and things like that. So now that he's finally in, even though it did take a year and a lot of work to get here, it's working like it should.
Thank you so much, Sunny. And we'll get in a little bit into some more discussion about some of these barriers and provide some advice. We're getting a lot of questions of people who are seeing barriers themselves. And we'll get into some brainstorming on how people can try to get over those barriers. I'd like to now introduce John Carmichael, who's the CEO of GT Independence, which is one of the 8 or 9, I can't remember the total number of FMSs in the state of California. GT Independence, however, is a national FMS and has worked in states around the country that on self-determination, their own self-determination programs. And so, John, we so appreciate you joining us to give us sort of a national perspective during this time of COVID and how participant direction is really becoming much more common. Thanks for joining us, John.
Thanks, Judy. Pleasure to be here. I've really enjoyed I just have to say, I've really enjoyed the panel so far. I've loved hearing the comments from Jim Knight, and it particularly drew on the "now is the time" message that he delivered. And then when I hear about some of the roadblocks that the group is experiencing, well, it just gets me really excited to work on some of those things, because, you know, as Rick said, they're solvable problems. And so it's just been, I have to say, it's been great to be a part of the panel so far. I'm going to share my screen. I have 3 slides. I promise I won't take more than my 7 minutes. And I want to introduce myself just briefly. I'm the CEO of GT Independence. We've been providing financial management services for 16 years. I've been a part of the company for all of that. I do this because my older brother, Ben, is a person who experiences a developmental disability, and I know what it's like to help him to have the kind of life that he wants. And so this is very important to me personally. So in terms of the national perspective, I have 3 slides here. The first is, what are the advantages of participant direction in a current environment? And I think a couple of these points have been touched on. CMS says, in their Appendix K to the waiver application, expansion of self-direction may be a useful option in an emergency situation. They go on to suggest that expanding services and expanding the ability to do things like purchase goods and services is something that states should consider during the time of COVID here. And then from the national group, Applied Self-Direction, they highlight the advantages in terms of the limits of exposure to COVID, because when you're hiring a person to provide supports to you, that's not a person who's probably visiting a lot more other places. And then it supports the continuity of services by making sure that you can still get services. And I think it does another thing. It helps to bring new people into this workforce, this really rewarding profession of providing support to people. So I think there's a lot of advantages at this time. So what are states doing? Well, we know that 24 states have expanded participant direction in some way as a result of the COVID, either by expanding the amount of services that can be self-directed, like what California did in the participant direction program, or by relaxing eligibility requirements for workers so family members can provide services, or maybe relaxing training requirements for people who want to begin self-directing. And we see this a lot more often in what we call budget authority programs, and that's more like the self-determination pilot or self-determination program. So that's what states are doing now. And then just briefly, what financial management service providers are doing to adapt to the current environment are moving to more remote services. So many FMS providers, this is something we typically do, will do an in-home enrollment meeting. Well, we've had to move that to an electronic format. And then, receiving service data through electronic submission methods, which is something that FMS providers should be able to do simply because most FMS providers are preparing for the eventual implementation of EVV, and that will be necessary at some point anyway. Another thing that may be obscure, FMS providers need to help employers navigate some of the benefits that are available during the COVID crisis. And one of the things is the Families First Coronavirus Response Act. This allows for paid sick leave for people who can't work because of a COVID-related reason. And FMS providers are finding themselves helping employers navigate this rule because it does apply to their employees. And another thing we're seeing is we're able to use data to identify potential adverse health outcomes, or really just look at the people that we're serving and use that data to provide assistance to make sure that they're being safe and they have access to services during this time. Last thing is there's a link on our website about FFCRA and our coronavirus response and some of the things that we're doing to help people if you're interested in checking it out. And that's it. How did I do?
You did great. You did great. There's been a number of questions that have come in, but I'm going to save them for you. People are still a little bit confused about the difference between participant direction and self-determination. So we'll try to make sure that we clarify that as we move forward on this. Our next speaker is Amy Westling, who may want to actually take that question for the future. Amy Westling is the Executive Director of the Association of Regional Center Agencies, and this is what, your third webinar you've been on with us? You're possibly our most frequent guest, I'm not sure, but thank you for joining us.
Yes, thank you so much for having me, and really appreciate the opportunity to talk about self-determination, and am really heartened to hear what Sunny was saying, that from their experience, regional centers are continuing to move forward with self-determination during this time. As Mr. Knight shared, one of the challenges that we know exists right now is background checks, but there is still tons of work that regional centers are doing and are willing to do to keep self-determination moving forward during this time. I was on the phone, or actually another Zoom meeting this morning with the chief counselors, directors of client services, those people that oversee case management at the regional centers, and posed to them the question, what are you seeing? What are you doing? And the biggest thing that they identified that they're doing during this time is taking the opportunity to reach out to people to do individualized orientation sessions. We know that to join self-determination, you have to go through an orientation, and they're adapting that for Zoom. Some of them are doing it telephonically. One center shared that they're contemplating using this little bit of time we have to go ahead and take those materials and make them available online for people, trying to meet people where they're at, recognizing that everybody's lives have gotten a lot more complicated right now, and that self-determination is about meeting people where they are and helping them to achieve the things that they want most. We also talked about self-directed services, and it sounds like there's still a little bit of confusion about the difference. And so want to spend just a couple minutes talking about that. One of the challenges with self-determination, and I really want to call out a couple. One is that at the moment, the program is limited to 2,500 people. And so the other challenge is that as Howard and Sunny talked about, getting enrolled in the program can take a little bit of time because you have to do, your person-centered plan, and you develop your budget and all these other things. But we know that people have needs right now. And one of the big needs that people have identified is, and I think I saw it in the chat box as well, is as traditional services may not be as available as usual, or as people are exiting school, or school isn't as available as usual, people need some way to kind of backfill that need. And so participant-directed services and the expansion of that into 3 additional categories, like Jim was talking about, really was meant to fill some of those holes in. And one of the other things we've heard from families is that as regional centers have offered additional respite or personal assistance or whatever the case may be, there are a lot of families that are really choosing right now to have less people in their homes, less people that they're unfamiliar with coming into their homes for health and safety reasons. And so participant-directed services and the expansion in this space was really designed to give people the greater flexibility and choice in terms of who supports them. So while Jim said that for certain services, we can't bill at the federal level if a parent provides them, we wanted to make sure that as we were discussing this option with the department, that it was, other than that, as free and open as it could be. Because we want people to have the opportunity to say, hey, right now it would be really great if grandma was available to provide personal assistance. Or if an individual is working in the community and they rely upon job supports and their regular supported employment job coach isn't available, then mom should be allowed to be paid to do that, because that's not a typical mom function. And we want to ensure that people's goals don't backslide during this time. So that's really the framework. There are a lot of parallels with self-determination, but this really was kind of self-determination light, if you will. And it was really designed to remove some of those barriers that we know exist in terms of the enrollment caps and just the time and the upfront investment with self-determination, so that we can be more agile in our response to the coronavirus situation, and really was intended to provide people with just more alternatives and more options, because ultimately that's what it's about, is identification of individuals' needs and giving them as much flexibility as possible to meet them.
Thank you so much, Amy. Our final presenter, and this will give us a lot of chance to answer the many questions that have come in, is Harvey Lapin. Dr. Harvey Lapin is the mastermind behind the self-determination law, and he is ready to launch. His son is ready to launch in the program as soon as these background check things are taken care of. So go ahead, Harvey.
Whoa, that's a good one. Thank you, Judy, and thanks, DVU. Connie's on the board. But first and foremost, I'm a father of a son, 52 years old, who is my hero. Connie and I have been doing advocacy for a half a century, long time. And what I'm saying here is my opinion, okay? First, thanking everybody, but I thank my dear friend, Senator Bill Emerson, who carried this into law. He is a wonderful person. I am a cheerleader for self-determination, 1000%. And it's a dream now that it's happening. And there'll be some bumps in the road, I know that. But I'd like to give, I've worked on this for about 12 years. I walked around with papers in my hands going crazy, handing them to people because I'm old, okay? And I'll give you a little lead on my family's journey through this to get to this point. Judy and Connie both know my mantra. Who is in charge? Is it the person with the disability and their family or the bureaucracy? This is a real good time to figure that one out. How shall I say this? Louis D. Brandeis, a Supreme Court Justice, is one of my great, great heroes. And he always talked about the curse of big. You can't be person-centered when you're a corporation. You're obligated to the corporation. And he also said always that you cannot have personal freedom without financial freedom. Lessons learned, okay? I'm going to say this, during this pandemic, this is an opportunity. Out of tragedy will come an opportunity. There's no question about it. And I knew Frank Lanterman. I knew him well. I did not know he had a family member with a disability at the time. My journey really started. I started a program in 1975, I think it was, at CSUN. It was a course. Went through the whole gamut of group home, supported living, supported work. And the bottom line on that, these are not bad. They're good people. They're not bad people. Who's in charge? That's the bottom line. The family and the person with the disability is not in charge. And that's how I really came to, okay, we got to do something about it. And I said that to myself. Self-determination to me is not just the money part that once you establish a budget and a spending plan, you really have the right to hire and fire. In the sole employment model, I'm a big advocate for the sole employment. In the co-employment, I tell you this, you are not the employer. What I've learned in life, count on, things will change, whatever it is. I know a few other things that go on. I wanted to bring on. We could open up theoretically today self-determination to everyone. There's nothing stopping it. Why? I ask a question now. Why are they going all of a sudden to participant directed in California? Why? Because they know they need it. Flexibility, values, family values. We've learned now through this pandemic that you're going to have to act swiftly. It's coming back. Hell, congregate, now do the right thing on HCBS rules. You got a shot at it. These congregate settings are petri dishes for disease. There's no question about it. Look back east. It's not just the person with a disability, their staff is dying. Get out of that. If we don't do that today and use this as a way to further people's lives, we will repeat this problem over and over again. It's so frustrating. And what ARCA can do in this situation is make sure that there's some consistency on the 21 regional centers. There isn't. Each one is different, and each one, there's been a barrier there, let's be honest, okay? And if you're not honest about that, those barriers will stay there. We are in an epidemic right now. This is a way to improve the situation. It's not a cure-all for everything, but self-determination is something we all desire and want, to be in charge of our lives. It's really quite simple. Freedom. Martin Luther King said it, free at last, free at last. I'm done.
That was a great way to end it too, Harvey. That was beautiful, beautiful.
Thank you.
Just so that you know, because I'm not sure you can see the chat, that Lisa Wynn said, thank you for your over 50 years of advocating for self-determination program so that my 22-year-old son can benefit. And we all share that thank you. All right, we're gonna go to some Q&A, and what I'm gonna do is open it up to any of our panelists to answer some of these questions. So feel free to just unmute yourself and jump in. There's a lot of questions. I'm gonna mute you, Harvey, and then you can unmute yourself when you wanna answer questions. So, I'm just going to re-clarify the difference between participant direction and self-determination one more time, even though Amy did it. So participant direction is only available to people who are in the traditional system. It's not available. It is different than self-determination in that anybody in the regional center system can access participant direction. The self-determination program is a separate program that 2,500 people have been selected to be part of a 3-year phase-in. That 3-year phase-in ends on June 7th, 2021. So just a little over a year from now, where it will be available to everyone in any regional center client in the state. So I just want to make sure people understand that. To be able to access participant directed services, you need to talk to your service coordinator. So there is a very big difference. The other thing that I just wanted to quickly clarify is that one of the questions to Jim Knight was, do people in participant direction, do staff need to have background checks? And while there isn't a specific requirement in the directive, there may be and likely to be requirements from FMSs. So with participant direction, you use an FMS to pay that individual that you have hired. And most FMSs, and John can really weigh in on this, most FMSs are going to require a background check. Now, does that background check right now with COVID include a fingerprint? Probably not, but they will run their own internal check based on the staff members, maybe their social security number or their driver's license number, something along those lines. So there is likely to be a background check on anybody you hire in participant direction, but it is not likely to be fingerprinting related, which is been the barrier for self-determination. So with self-determination, there must be a fingerprint, and many of us feel uncomfortable asking staff to go to a location that may be far from their home and sticking their fingers on something, which is the exact opposite of what we should be doing right now. So I don't know if John, Amy, Rick, anyone wants to chime in on the differences that I talked about or anything? Did I get it right? You're all muted, so I'm assuming, oh, John, you're just unmuted. Go ahead.
I could speak to the background check point that you raised, Judy. I would say that, you know, one of the things that's really important about removing barriers to self-determination is to sit down and clarify some of those policy questions up front so that everybody feels safe proceeding, knowing that we've kind of written down the rules already. And some of those rules still need to be sort of addressed. And so, for example, criminal background checks, it's something that, you know, we can sit down and talk about in terms of, you know, what is the full employee eligibility policy that includes who's allowed to be an employee, what is the background, and then what type of credentialing do they have to present in order to be able to work. For many of the services, there's nothing, but like Jim was saying, it's available for nursing, but you have to be a nurse to provide that service. So let's just figure those things out and develop that policy together. And then I think, and make sure we're communicating it really well. And I think that those questions become easier to answer as we're setting up these self-directed arrangements.
Great, thank you.
Judy, can I say something? Yeah, I'll give you the absurdity of this. Part of it, well, we thought we were doing the right thing when we wrote the law, when we put this in statute compared to regulations, but that's another story. The issue, I'll give you an example, our issue, my son has lots of challenges, has lots of staff. Every one of that staff has had a life scan at one point. Every one of them, okay? Known him for years, been in Sean's life. Yet we're at a dead stop right now. Everything's done. Absurdity, absurdity. How about people before paper?
I like it. Yeah, I completely agree. Go ahead, Rick.
I've got a quick comment. Perhaps you can address this so that it is clear to the audience. Not every person who is hired by a participant in self-determination is required to undergo a background check and the fingerprinting. And could you explain to everybody what the differences are between those who are required to be checked and those who are not?
Thank you, Rick. Yes, that's a good point. So for example, Howard was able to jump into self-determination a couple of weeks ago because he is hiring an agency. He's using an agency to provide him with personal care. So that agency already has their background checks done. So that is one way to do it, is to have an agency so he is actually using what we know. There are 3 models of FMS. He's using the bill payer model because he is only hiring agencies. So he doesn't need background checks. But even if you're using either the co-employer model or the sole employer model, so you're hiring your staff directly, and so they will require a criminal background check. There's only certain staff who are required. It's just personal care attendants. It's those direct support professionals who require it. So for example, the independent facilitator doesn't require a background check. If you're taking a class, you know, right now it's not in person, but, or you're hiring a person, for example, Howard's hiring a person to do a website for him for the public speaking and other work, violence prevention work that he does. That person does not need a background check. You can have anyone you want as a participant. You can require a background check, but what the state requires is only those people who are providing direct personal care. So, so whereas my son's plan has maybe 10 different people involved, as people advising my son on kind of independent living skills, others on some, you know, sort of stress reducers, nutrition, all these kinds of people. None of these people are providing direct support care. So none of them need the background check. It's just the 2 individual staff who are with him personally who require it. And unfortunately, in the statute, it specifically says that they are requiring a separate fingerprinting and a separate background check than they would be getting under if they're working for other agencies. I agree that with Harvey, that it's very frustrating, particularly at this time. All right, I'm going to move on because we have so many questions to answer. There's 30 of them right now in the queue. So I'm going to try to figure out what this question is. It says, what is the criteria around the validity of client attendance in delivery of various teleprogramming and direct support services, such as essential shopping for the client? How is attendance quantified and reimbursed? Amy, is that a question that you can answer? Thank you so much.
Yeah, so right now for under a directive and actually under current regulation, non-residential services are being paid essentially what under federal law is called a retainer payment. So it's payment to keep them going during the pandemic, essentially. And we, as a system, the department has made clear that the expectation is that those service delivery systems, so day service, ILS, those kinds of things, remain engaged and have suggested alternative service delivery. Some of that is being done remotely, some of it is food delivery, those kinds of things. So those services that are being done for individual people are billed on an hourly basis primarily, and it's still noted which consumers they're providing services to. And then the remainder is paid for to cover the absences for the time that service couldn't be delivered in one way or another.
Thank you, very helpful. Here's a question from Richard Deere. Can self-determination program participants jumpstart with participant directed while waiting for background checks? And I'm going to throw this to Amy as well. I'm expecting the answer is probably like, yeah, you can, but it sounds like it might be just worth just to get the approval of participant directed may take enough time where we're hopefully getting this background check thing solved. But what do you think, Amy?
Yeah, I think as you mentioned, Judy, participant directed is an option for those people who have not transitioned to the self-determination program all the way. So if the current status is somebody who's been selected, much like the status Howard was in up until very recently, if you've been selected, you're beginning to build your budget, but you haven't come online yet, then absolutely this may be a way to jumpstart or test the waters and see what elements of participant directed work well for you, what maybe you want to use an agency for, those kinds of things. So absolutely.
Thank you. Here's a question about and Harvey alluded to this, can the self-determination pilot be expanded to help individuals access care? There was a second question as well, like why is it that self-determination in this time of COVID is not available, a year earlier? Of course, we've been arguing that it should be available to everybody since Harvey and I participated in writing the language. It was part of the negotiation we had to get the bill passed, that it would be slowly implemented. So, certainly Harvey and I would like to expand it. I can tell you what it would require. It would require a statutory change. It would, actually, the Department of Developmental Services has the authority to expand the number with just the approval of the Department of Finance and the Legislative Joint Budget Committee. It's certainly something that we are interested in. But before I hand it over to Harvey, let me just tell you what we will face if we ask DDS to do this, if we ask the governor to do this, if we ask the legislature to do this. We're going to face this question. And I know that we have we have 2,500 participants who I'm hoping will hear this. They will say, well, you can't even get 2,500 participants in. Why would you want to expand it to 360,000? So my response to that is to reach out to all of you 2,500 who've gotten in, to tell us what is it that's keeping you from moving in? What are those barriers? We've been hearing a lot of them. Rick and Maria talked about a lot of them. And I know Sunny has a whole bunch more that she hasn't even talked about that she's made me aware of. Let's get them all out right now. Let's try to figure that out on this call. We have another 40 minutes where we can talk about these barriers. And if we can get more than right now, I don't even know how many are in, but I can't imagine it's more than 150, maybe 200 in the whole state. If Lanterman Regional Center, where Howard is, has just one participant, I can tell you mine, Westside Regional Center, has 4. We only have 4. So there's not a lot in the state beyond the, I think, 90 or 85 pilot participants. Maybe we've gotten 50 to 75 in. So we got to get all of us in first, and then we can start making this case, I believe. But go ahead, Harvey, you build on that.
Yeah, I'm on. Okay, I'm brutally honest, okay? If you don't want to do something, it'll be like it is now. I think the opposition, a lot of people, they don't want to do it for lots of reasons, and main reason is who's in charge. I'll give you an example. The state of Wisconsin has over 20,000 people in self-directed or self-determination, various forms. I'm not 100% familiar on the quality and everything else, but they have over 20,000 people. 4 years ago, I had a conference call to the state of Michigan. I had the people that were the advisors on how to do it in Wisconsin, all of them were on the phone. The people like Don Hoyle, Jim Deemam, Paul Newman, not the one who's dead, okay? Okay.
The celebrity.
Right, reincarnated, okay? And Annette Downing. These are people that don't know systems change. Hey, we don't do this. Someone's gonna do it for us, and it's gonna be done wrong. It's who's in charge. Is this system about people with disabilities? I made this statement up in Sacramento before. Our kids give you jobs.
Thank you, Harvey. An additional question that's asked by that same person is, can training for the self-determination program be offered online? Absolutely. I can tell you that my local advisory committee had this discussion about orientations for new participants can absolutely be done. We're not going to do it for as many hours in one chunk as when you're doing it in person, but we were talking about doing it in maybe, you know, an hour and a half, 2-hour segments and getting people through orientation. So absolutely, we can do this. We've always been able to do it. It's not because of COVID that's not creating any new opportunities. We've always been able to offer it online. Okay. Regional, okay, this is a question about insurance denial. And I think that, so everybody knows that the regional centers are payer of last resort. We are supposed to go to what's called generic resources, or resources that are available to people beyond the regional center system to try to get them to pay first. Places like school districts, Medi-Cal, health insurance, Department of Rehabilitation. We are, even in the self-determination program, we have to ask for these first. The problem is that these insurance denials can take a long time. They want to know what they can do. So for example, their child went to see a professional who does not take insurance, and the insurance does not pay for the recommended service. So it's going to be a process of asking the insurance, getting a denial. So let me just give my take when we get asked these questions within self-determination. So it is absolutely true that we have to continue to use generic resources in self-determination. And you should look at it in a different way in self-determination than you have probably traditionally looked at it in the traditional system. Think of generic resources as free coupons. It's like you have a budget and you have X amount that you can spend, and somebody's giving you a coupon to get some of the things you want for free with somebody else paying for it. You want to try to use that as much as you can. So for example, you are wanting to start a business and you need a computer to start that business. Well, did you know that the Department of Rehabilitation may provide you with that computer to start the business? So wouldn't you rather have the Department of Rehabilitation pay for that computer as opposed to you're taking $500 out of the self-determination budget? So that's why generic resources are actually can be a very positive thing. At the same time, you can also reframe your service so that it doesn't look like a generic resource. For example, you may have, for behavioral services, you may have to use your health insurance to pay for behavioral services. But for my son, he's using our old behavioral person to provide job coaching, which is not part of what behavioral therapy usually does. But because this individual knows my son so well, knows what challenges he may face in a work setting, she is creating some plans for him as his job coach to be able to get work. So we're calling her a job coach, which doesn't require us to get a generic resource. We're calling her a job prep person. So that's why, you can be very, very flexible within self-determination on how you use your budget. Does anybody want to add anything to the question of generic resources on self-determination? No? Okie doke. All right, our regional center currently has open slots for the self-determination program because some people have dropped out of the program. My son has been on the waiting list since August 2018. Can we please open it up? So let me just make a point about, which is something that Jim Knight would say if he were here, is that a lot of people dropped out. A whole hell of a lot of people dropped out after the first election. Way too many. And back in this last November, DDS did a new draw, and they drew significantly more people than dropped out. So I don't remember exactly the number of people dropped out, but I think it was around 500 confirmed to be dropped out, and with another 500 or so who hadn't yet finished the orientation. But they selected significantly more than 1,000 people for the next round. So for example, my regional center is supposed to have 64 people in the program, and I think we have well over 80 people selected, yet obviously only 4 have gone in. So that's how come I think that they're already trying to move people through the, you already have the waiting list people already in the program. So I'm not sure they're going to add to it. I think that what our time right now needs to be spent on is getting these folks who have already been selected in so that we can make the valid case. Look at how all these 2,500 people are in. It's very successful for these people. Let's expand it sooner than June of 2021. All right, next question. Have all the regional centers agreed on a formula for creating a budget, an individual budget, and can all regional centers now get money out to their FMS? How do you recommend we move forward with our FMS who cannot seem to move forward with us at this time because of COVID-19? So I'm gonna ask, I think, Amy, Sunny, John to answer this in any order they'd like.
This is Amy. I'll go ahead and answer the first part of the question. Yes, regional centers are using a consistent tool. When we talk about the budget, we're talking about really 2 pieces. And the piece where there's a lot of consistency is with the tool to determine the amount that each person gets to spend. And there is a formula that has been worked on. Judy and a lot of other folks have worked on it with us. And the department to make sure that we're really capturing all of the costs that would have been spent on the person in the traditional system. And that gives us the place to then develop the individual spending plan.
I can add to that. So it should be that way. It's not totally. I've worked with 5 or 6 regional centers in the LA area. Most of them use that tool that DDS created. 2 of them do not. One has a tool that is similar that they created that they're using, and one has no tool, and they're not using the DDS tool as far as I know. At least the team that I'm working with, which consists of a service coordinator and a supervisor, had never seen the tool before yesterday. So that tool also, even for those regional centers that are using that tool, there's discrepancy in how it's being used because there's not training on how to use it. And so sometimes a service coordinator is given the responsibility of calculating the budget, but they have not been trained in that tool. Sometimes they are not aware that there is a tool. Maybe someone else at the regional center does know about the tool, but the information hasn't gotten to the service coordinator. And so it's sticky. And again, there aren't that many people in the program yet still, unfortunately. And so what the stories that I'm sharing, most of the experiences that I'm having and the clients that I have are people who are the first or amongst the first at their regional centers. So once they go through it, like I'm already seeing a change once the regional centers have a few people in or they've gone through it a few times, I think this stuff will really improve pretty quickly. But for those people which we're still at that point, like the first 5 at every regional center are gonna experience, I think, these challenges. And I would say that that's why it's really helpful to have an independent facilitator who knows, and there's a lot of really great ones out there, but someone who knows what's supposed to happen, how the budget tool works, because even the regional centers that are using that budget tool that seem to be trained on it, I still usually find places where things should have been done a little bit differently. So try to find someone who can help advocate for you and support you to go through that process with the regional center.
Judy, can I tag on to that?
Please.
So those are really good points, Sunny, and you're drawing from your own experience. The budget tool has been described by many as very difficult to navigate. To me, it looks inflexible. It looks bureaucratic, which is the antithesis of self-determination, obviously, which is governed by or at least one of the hallmarks is the flexibility in approaching that which a person needs or wants. We have large segments of the population who are underserved. We have many parts of this state where there are services that would be available in a different setting or a different geographic location, which are not available to people. And I think the important thing to remember, and we certainly went through this a couple of decades ago, and we're some of the instances that I have some personal knowledge of now, we're going through it now. If the budget tool is designed to as a starting point, that is how much money was spent in the previous year, and that's the pot of money that becomes available for the services and products that a person would like to have. May be the same, might be different than that which was offered through the traditional delivery. The problem is that it doesn't take into account the things that would have been available that you couldn't get or you couldn't have because they aren't available in your area. Or even if they are available, if the person or the family doesn't know about them and had not previously received them, they in effect don't get credit for them. And so this is a really important part of self-determination. When the budget is developed, it's going to be important for all of the participants to not just say, all right, here's the number that was spent. We're going to try to fit everything we want, the same or different, into that number. Generic services aside, it's going to be really important for people to advocate in many instances for more than they were previously receiving. What we experienced, I know that other pilots did as well. For the benefit of the audience, there were 5 pilots, approximately 150 people in the state of California that were able to participate in the self-determination pilots a couple of decades ago. And what we found in our pilot was that we had a vast underserved population for the reasons that were stated. And as a result, our budgets actually, in many instances, went up. Not all instances, in many of them they went down, but in many instances the budgets went up in order to receive that which they otherwise would have been entitled to had they perhaps been living in a different area. So I think the important thing about a budget and the development of it before certification is to advocate very strongly for that which a person needs or wants to contribute to his or her happiness and quality of life, irrespective of what has been spent in the previous year.
Thank you, Rick. John, did you want to add anything or no? Did I miss?
So just briefly, there's a couple elements to creating the budget, and forgive me for not being fully intimate with the process, but there's the part of the process where we figure out how much money is going into the budget, the revenue side, and I think that's what most of the discussion has been about. I see the role of the FMS as, once that's identified, helping the person along with their circle of support make sure that they've calculated all the expenses that are going to be associated with actually purchasing the services, and making sure that they understand how that's going to work, and then how the reporting is going to work on an ongoing basis, so that people are able to effectively track their spending against their budget. I think that's really where the FMS comes in.
Right. So speaking of that, Charlotte Brown, whom I love at Regional Center of Orange County, whose daughter has been in the self-determination program since the original selection in October of 2018, has been still fighting to get her daughter in. The biggest problem, and Sunny can totally back this up with her own clients, is that the regional center is making is making decisions about whether the spending plan can be done in the way they want it to. So there's the first fight that many people have with their regional centers around the number, the individual budget number. That, then we get an agreement, that becomes certified. Then the participant starts to create, with their independent facilitator and their FMS, their spending plan. And that spending plan is based on their person-centered plan. That spending plan is not based on the traditional system. It's not based on what service coordinators have done traditionally. It is based on their person-centered plan. And what we're seeing is regional centers coming back to participants and saying, oh, you can't do that. You can't spend your money that way, or you're asking for things in the wrong way with categories. And I believe it comes back to the lack of training of service coordinators and regional center staff on the self-determination program, which is not their fault, by the way. It is not their fault that they haven't been trained on it. DDS and we called for this in the statewide advisory committee. We called on DDS to provide a statewide consistent training for regional center staff so they're all getting the same information so that they're not all over the place on this. I feel bad for the staff, actually, because they're kind of making it up because they're not sure what the right answer is. So I don't know, Sunny, if you want to, talk about that as well. And Amy, I'm sure you've heard some frustration from regional center staff. So go ahead, Sunny.
Thank you, Judy. So I actually have two things to say. The first is I can answer that about the spending plans in a second, but I do want to share this important tip about your budget and developing your budget. So even though in self-determination you can do really non-traditional things, and Howard shared some great examples today. We hired someone within the last few weeks to type his novel for him, which he's handwritten. We have someone working on his website, which is going to help him get more speaking engagements, which is employment related. So you can do really non-traditional things. However, your budget is still based on the traditional system. And so if you approach, and I've heard people and I think I saw a question about this too, if you want to do something non-traditional and you're still in the point of the process where you're discussing your budget with the regional center, if you say, well, I want to hire someone to work on my website, or I want to attend this event, or whatever you want to do that's not traditional, even though I think once the regional centers and the service coordinators get used to this, they should be the ones to say, well, what that sounds like is you need employment services, and they could back it into the traditional system. Right now, they're not quite there yet. And so if you say, well, I want to work on my website, most likely the response you're going to get is, well, that's not available in the traditional system, so we can't put money in your budget for that. So it's really important when you're framing what you're wanting that you're not looking at what the outcome is that you want, or the service, what you want to pay for. You have to look at what the need is. I need help with my employment. I need help with making friends. Those are things that the regional center can do in the traditional system, and that's what your budget is based off of. So really focus on what your needs are, and when you're talking about the budget, and not what services and supports that are non-traditional that you want to use to meet those needs. So that's my first tip. And then what was the question about the spending plans?
I mean, my basic question, and both you and Amy can answer this, is what are regional centers allowed to tell participants that they are not allowed to spend their money on? So what are those ramifications? So I know that they are supposed to be hands-off as much as possible. And I know that health and safety is a big one that they should be, somebody wants to spend their money eating McDonald's or being taken to McDonald's 3 meals a day. A service coordinator can maybe say, maybe that's not the best idea. However, it's, if it's not health and safety, it needs to fit into a federal service, one of the federal government's approved services. And those are 26 pages of services. They are so widespread, and if it doesn't fit into one of the 26 pages of services, it can also be what's called participant-directed services. Mm-hmm. And so there is a wide range of things people can do. The whole point is to be innovative and creative. And Nancy Bargman talked about that at our self-determination conference. So I guess my question to Amy is, I know we have a lot of regional center staff listening in on this, is what would be your advice, since DDS has not provided this extensive training? to regional center staff, what would be your advice to service coordinators and supervisors who are working directly with participants on what are the kinds of services that you are allowed to say to the participant, no, this is not approved. You can't do this.
Thanks for the question, and did want to answer that, but first want to go back to what Sunny was saying in terms of the way to approach the budget development, budget in terms of the amount of dollars. She's absolutely right. Because of the way the law is structured, which was intended to give people as much money as possible in terms of being able to pay or to have a budget that is 100% of what the regional center would have spent on you in the traditional system, not just limited to what was spent on you last year, you almost have to do a mock IPP. It sounds ridiculous, but you have to say, here are my goals, here are my needs. And then you almost have to say, and if we were just limited to the traditional system, what would my services look like? And that's how you build your budget. So you know, a great example is social rec, which we know in the traditional system isn't available. That may be an interest and a need that you have, but you have to identify it a different way and work with the services that would have been available in the traditional system. Not that you have to use those services, but that's how you build your budget. In terms of what a regional center can, they can't use their budget for, of course, it is all of those things that are a danger to health or safety, as you alluded to, Judy. It is also things that are not federally approved, and some of the things that aren't federally approved are the direct payment of food, clothing, and shelter, as well as some limitations around ensuring that if we're purchasing clinical services, that they are evidence-based. And back to the original discussion around generic services. So those are really the big ones where there's the most significant challenge as we put together the spending plan.
So all of you who are out there who are participants and all of you who are out there regional center staff, I agreed with everything Amy just said. So this is a meeting of the minds where DVU and the sponsor of the bill and ARCA agree on this. Amy and I have worked together for many years on creating this agreement on what this all means. And so we're hoping that if everybody out there learns this, that we will not be experiencing these continuing barriers. So, you know, I really recommend that if you're facing some of these barriers, that you do reach out to us, to ARCA, to DDS in particular. You know, DDS is a little bit distracted right now. So is probably ARCA, but we all are. I mean, there's a lot of really crisis stuff going on, but I believe that this kind of stuff will help us get through this crisis. There's some questions. We're going to go back to participant directed services. I'm sorry to be all over the place, but people want to clarify. People are asking questions like, how long should it take from the time you ask for participant directed services until the time they're approved so you can get started? And Joyce Clark in San Diego is asking, has DDS provided any guidance to regional centers related to participant directed services? Because not all the regional centers are providing the same information on how the process is going to work, how the payment process is, living in the household versus not living in the household. So have regional centers gotten guidance around participant directed services?
Yes. Had to scroll back to Zoom to unmute myself. Yeah, so DDS provided guidance to the regional centers in a directive on March 30th. You can find it on the DDS website. It provides some kind of broad guidance around participant directed services. And the important page for you to look at is page 3 of that document, because it says for, you know, these services, here is the process. Here's the rate. It has to go through an FMS. Here's what it takes for for a person to qualify for to be the service provider. So that's really the page you want to look at, is page 3 of that March 30th directive. I believe they also have a plain language summary on their website, but it doesn't provide nearly as much detail as that page 3, and that would really be the jumping off point. And one thing I would recommend, if you're interested in pursuing the service and you're really running into maybe a service coordinator that isn't terribly familiar with it, I would send them that document and say, hey, here's exactly what I'm talking about. And it lays out exactly what service code, it lays out the rate. You know, one of the challenges that regional centers are having right now is, just like everybody else, they're getting used to remote working. And so sometimes the flow of information through the regional center system down to the service coordinator level may not be working as well as it had historically, because some people learn best when you hand them a piece of paper. Well, we can't hand them a piece of paper. So if you're looking for this service, absolutely say to your service coordinator, I'm looking for personal assistance as a participant directed service, and here's the directive, and it provides pretty much good instructions on how to do it.
And you can find that directive on the DDS website. I put it in the chat as dds.ca.gov. Right when you get on their website, it says COVID-19, and you go in there and look under DDS directives. You can also find it on our our coronavirus resources website at disabilityvoicesunited.org/CV. It's important that people understand this and that there's consistent answers that people are getting from their regional center. Okay, moving on. What do you suggest to consumers and families that are still on the waiting list? This is a similar question we've been getting a lot of, especially with this pandemic. There are no day programs open and very limited options for consumers, especially those who are aging out of the school districts and need to have activities to do during the day. Having flexibility to create a virtual program, being able to access different organizations that may not be vendored with regional centers would be extremely beneficial. Is there any way DDS would move it up? So once again, for those of you who are participants in the self-determination program, let's get you in quickly so that we can make this case to get these other folks on the waiting list in. But you know, as we've been saying, choice and control still can exist. It's not as flexible as self-determination, but it does provide you with some choice. Some additional choice, which is this participant-directed services. So, you know, please today send an email to your service coordinator saying that we want to hire these people to do this kind of work for us. It would go under, you know, these kinds of services, and so, you know, please put in that request as soon as possible. Harvey, did you want to say something? Go ahead.
Yeah. You know, an important question like participating direction and all that. What we have to say to ourselves, what have we learned from this pandemic? Meaning everybody is quarantined to a large extent. They're at home. We've learned a lot that may expedite this because we can work in a different way and it can be done successfully. Time is money, okay? So what we have to do is take a good dissection, my doctor, of what has happened to us. That's it.
Thank you. Okay. This is a question that I know what the answer is, but I'm going to throw it out there. Will the FMSs pay providers for overtime under the self-determination program? If so, does it need to come out of the participant's budget? Will regional centers need to fund this? As currently, regional centers don't fund overtime for providers. SDP is supposed to be cost neutral, and regional centers are only able to fund services for participants regardless of the individual participation in self-determination. So John, I don't know if you want to talk about the ability of self-determination for participants to pay overtime.
I can speak generally to it, but I'm not entirely familiar with the program rules for SDP. Again, I'm sorry. in a sole employer arrangement where the individual is the employer, if their worker works more than 40 hours a week, they are generally required to compensate that worker at the overtime rate, which in most places is time and a half. So it's not a choice, it's a law. And as an FMS provider, you know, it's kind of our job to of course follow the laws, but to also to advise employers on following the laws. In a co-employment arrangement, the FMS provider is more liable for following the law because they are a joint employer of that worker. So I think in either case, it's advisable to make sure that if you've got people working overtime, we're following the law. Now, there's a question as to whether it's appropriate to have a person work overtime. And I think that's a policy decision that a state or a regional center can make, but they risk becoming a joint employer in that situation too, when you start constraining the employment relationship in that way. So it tends to be a thorny question. And I would say in general, employers are required to follow the law.
Yes, in general. So let me give some advice to folks of what we did in our spending plan, because you need to account for overtime in your spending plan. It's not like, oops, oh, a lot of our staff were required to work overtime. It was time and a half, and look at our budget's been eaten up and we need more money. Your budget's not going to be increased because you screwed up on the overtime. So what we did is in our budget, in our spending plan, we accounted for the time we might need overtime. So while we have an hourly dollar amount for our staff, who generally, for my son, because he still lives with us, they generally work between 30 to 35 hours a week. So none of them are really getting close to 40 hours a week on a regular week. We know in the non-COVID world that there might be times that my husband and I might go away for a weekend, and therefore my son's staff might need to stay overnight, and therefore it's going to bump them over the 40 hours a week. So we kind of calculated how much we wanted to be away, and boy, do we want to be away right now, but we can't. But how much time we are going to be away, and we added in at time and a half an extra 60 hours for the entire year for his staff to be paid overtime. So no, your budget's not going to get increased. Yes, you are required by law, whether you're a co-employer or a sole employer, you are required by law to pay your staff overtime if they're working more than 40 hours a week, and you need to account for it in your spending plan. Rick, I see you want to add a comment.
Yeah, it's just so well put. You articulated that perfectly. You get to decide how you're going to spend the available dollars. And so in answer to the question, you know, can you pay overtime? Well, you have to pay overtime if there is more than 40 hours a week. You have to pay overtime, double time, if there's more than 12 hours a day. That's the law in California. And so the FMSs, of course, know those laws. One of the great benefits, I think, or services that an FMS can provide is to each month tell you how you're doing on your budget and warn you that if you are overspending for one reason or another, at least in comparison to what you have expected to spend, that you may run out of money before the end of the year. And so FMSs are it's very important for them to be very proactive. But again, this is the great thing about self-determination. First of all, in your budget, you can anticipate that there's going to be overtime. We know that stuff happens in life, and overtime is almost inevitable in any business. And that's really what this amounts to. It's the business of hiring people to provide services and supports. And given that, and once you have that number, it's the responsibility of the participant and the family to monitor that so that you don't run out of money at the end of the year. It's helpful for the FMS to advise as to how you're doing, and you have to comply with or obey the law.
Thank you. Here's a question on self-determination. Are participants in self-determination required to have an evaluation assessment at hand to prove that they need a support service, even when the need is obvious and documented in other ways? Can a regional center propose an assessment for the participant to attest the participant can receive that service? My fear is that if regional centers assess a self-determination participant, they can say in the evaluation that the person does not need it. So let me try to at least take the first shot at answering that and then ask others to chime in. So it depends on what you're talking about. If you are talking about the development of the individual budget amount, it is possible that a regional center may ask for an assessment. So for example, you may be an individual who lives with your family and you may want to move out into supported living. Your regional center may drive you not happy, but it will. They may require you to do an independent living assessment, as any traditional traditional consumer would have, to determine what your level of need and support is in supported living. Based on that assessment, you can then create what that dollar amount would be, and that dollar amount goes into your individual budget. Now, once you have that budget and you are creating a spending plan, the regional centers cannot be requiring you to do an assessment. If you decide in your spending plan that you would like to get a job working at an auto mechanic shop, they can't make you do an assessment to see if that's a good job for you. If you want to spend your money in your spending plan on let's say, what do they do assessments on? Behavioral therapy, or you want to use a behaviorist in some kind of way, you do not need to have an assessment. That is your choice on how you spend your money. And as long as you are doing what Amy was talking about, which is, making sure it's in the federal waiver, make sure that you're keeping your health and safety, make sure that it's generic, that you can't access generic resources instead. And finally, another piece is to make sure that it's not in a congregate setting, that you're abiding by the new HCBS rule, which we haven't mentioned. Right now, nobody's in a congregate setting, so you're all okay. But as long as you're meeting all those things, you can pay for it, and they cannot require an assessment. So I don't know if anybody wants to chime in on that.
I am seeing people needing to complete assessments. I just want to particularly, so it really applies for the services. If you were staying in the traditional system, there are certain services that if you ask for it, there's a clear need that you need it, that you will get it. There are other services that always require an assessment in the traditional system. And what I'm seeing is that pretty much every regional center, with the exception of maybe one that I work with, is still having people do those assessments. So that's independent living skills, behavioral therapies, supported living, at least as it applies to adults. And people on those assessments, unfortunately, do slow down. It's another way of slowing down the process. One of the good things that can come out of an assessment is if you were, this might be a benefit. Depending on what agency conducts your assessment, whether or not you intend to hire that agency, they will make a recommended number of hours. And depending on the timing of things, if you were to get an actual authorization in the traditional system to go ahead and do the services that agency is recommending, sometimes the rate that agency is paid might be higher than the average rate for that service at your regional center. So in that sense, then you would be given the rate. If you have an active authorization for the service in the traditional system, then your budget would be based off of that rate rather than an average. And so sometimes it can be beneficial for the budget, even if it does slow down the process quite a bit. Doesn't always work out that way, but.
Thank you. Okay, let me keep going. So somebody's just asking, I've heard this question before, can a person do kind of part of the traditional system and part self-determination, or do they have to choose one or the other? You have to be in one or the other. You can't like straddle those systems. Once you get your self-determination program running, you got to launch all the way in. So you can't like start halfway. Sorry about that, folks, but it would be really hard to do the billing at a regional center in that way.
True, Judy, but you can still use the same services, exactly the same services that are offered and provided in the traditional delivery in self-determination. What we have found in the 36 members of the pilot is that many of the services that were offered before were used by those in self-determination. The difference is you get to choose them. You get to control how much or how many of the services you're going to provide. So you have to be in one or the other. You can't be in both, but you can certainly have a plan and a budget that looks very similar to that which you would have had you been in the traditional delivery.
Right. And Howard, in fact, is doing using some traditional services in traditional and non-traditional services in his program. Okay, moving on. This is a question for you, Amy, from Pierre Landry. Is ARCA providing advice on training and support procedures for service coordinators across the regional centers so the regional centers don't have to figure it out independently? How about managing the reporting to local self-determination advisory committees? And is ARCA advising regional centers on how to develop and manipulate the data about participants? So I know there's a lot of different questions in there. But I guess you can start on the first.
Yeah, so ARCA, if you think about ARCA as just me and my 6 staff, we're not providing regional centers with guidance in terms of how they should do staff training. But one of the other things that ARCA is it's an opportunity for the 21 regional centers to come together and share best practices. And there's what's called a training and information group, which Liz Harrell was formerly a huge part of. And that group is collaborating to share best practices and training materials across regional centers so that it's not reinventing the wheel 21 times. In terms of reporting to local self-determination committees, self-determination advisory committees, each regional center is doing that on its own, in part because each local advisory committee wants different information. And then the third question, I'm sorry.
Is ARCA advising regional centers on how to develop and manipulate data about participants?
No, in terms of the data that's readily available on self-determination, most of that comes from the department. So you won't see ARCA saying, oh, here's the number of people enrolled in self-determination. Really, all that information is collected from the regional center's computer systems and is rolled up at the department level. So we don't have a role in that. And individual regional centers are not calculating kind of statewide data on the self-determination program.
Thank you. Sandra Adanya says, good to see you, Harvey. And she has a question for you. Harv, you there? Okay, I'm gonna unmute you. Or you have to unmute yourself, actually. She's asking, I heard an attorney say that self-determination is in conflict with conservatorship. I don't see it that way. Can you explain why it is not? Can you, you guys muted yourself, so I can't unmute you. So press unmute. Oh, still working on it. There you go.
Hey, yeah.
So the question is around, can a person in self-determination be conserved and still have a person-centered plan and have their wishes?
Absolutely. Absolutely, 100%.
Yeah, so.
Because I'll be honest, because of our age and everything else, Sean is conserved. We had a person-centered plan.
Right, yeah. So I think there's been some federal direction around this. So the federal government is requiring person-centered planning for all people served through home and community-based services waivers by March of 2022. And they have a specific directive around person-centered planning. And it, both within the self-direction or self-determination program and people who are in the traditional system are also going to be required to have person-centered planning. So they specifically talk about conservatorship in this, and they make it very clear that person-centered planning is not conservator-centered planning. It is the person, whether they're conserved or not. However, a conservator may make some choices that maybe that the person may not agree with. And it's one of the reasons why we as an organization are always looking for alternatives to conservatorship, such as supported decision-making, so that a conservator, because at this point, honestly, a regional censor could not sit in a room with a conservator and say, I'm not sure the person wants this, and then we're going to overrule you on it. They may be able to make the point, I'm not sure the person wants this, but they can't really overrule a conservator. We trust that the conservators are coming in and actually doing what the person wants, but the conservator does have the total power over the individual.
Aged and not having support.
Well, a big thing, put it this way, am I for the supported decision-making? 1000%. But it also is on circumstances. I'm 83 this month, okay? You got to develop it, supported decision-making. It's going to take some time.
And our group aged.
Yeah. Our group is
You always practiced it, Harvey, with your son. Even before supported decision-making was a thing, you always practiced it.
Yeah,
So.
and it's a limited. It's a limited and a person-centered plan. So as far as I know, we've done it because of our circumstances that we've faced at this point in life. And I don't think someone can say to you at this point that, oh, you can't be conserved and be in self-determination. I don't believe that.
Right.
At all.
So I'm looking at the time and realizing that we still have 36 questions that have come in. So I'm going to just try to because a lot of them are overlapping, and I'm going to try to summarize and just take another couple. Let's see. So one quick question is like, what's going to happen next year when everybody goes in? Somebody was asking about whether people are going to have to go through those informational meetings to go in next year. No, I don't think you will. I guess regional centers could personally require it, but that informational meeting was only a requirement for people to get on a list for the 2,500 person phase-in. I don't think any of us has even thought about whether that requirement will remain, but I doubt it will. It says, oh, here's an interesting question. I have been instructed to contact multiple FMS providers to see which one will allow me to pay staff the highest wages. Does the panel have any insight for me on this? If so, why is there a difference? Do all FMSs have the same employer costs, employer taxes, and insurance charged on top of employee wages? John, I mean, certainly paying staff the highest wages, that is your determination, but are there differences in the way that FMSs charge the employer costs?
I think that you may see differences between the sole employer and the co-employment model. I can say from our perspective, under the sole employer model, which GT Independence prefers, we're simply taking the wage, adding the applicable taxes to it, and that's what your budget is being charged. It's a complete pass-through for us. Now, there are other expenses associated with being an employer. For example, you may have to purchase a workers' compensation policy, and you may have other employer-related costs, but those are pass-through costs. So under that model, I think you should always be able to pay the highest possible wage that you can. Unless other FMSs aren't treating it as pass-through costs, and I don't think I can speak to that, but we are. Under a co-employer model, it's a little bit different because as an employer under a co-employment model, you're accepting some of the liability. So it's not always directly a pass-through cost, and it may result in you not being able to pay as much of a wage to your worker as you would in the sole employer model. So that's really, where we come out from our perspective. It shouldn't be, at least in the sole employer model, a way. You shouldn't have to make that decision based on how much you can pay your employees. That should all be passed through costs.
Right.
On the co-employment model, I can see that there might be differences.
Harvey, you wanted to add something?
Yeah, real quick. People have to also understand that on your renter's policy or your homeowner's policy, you can include workman's comp. I'm with USAA, I'm ex-military, and they're very good because they have a lot of servicemen that have served and need support at home. So they do cover it, workman's comp. So, there's different ways to do it, and your facilitator should be pretty well versed in that type of thing and checking those things out, and the FMS.
Mm-hmm. So, workers' compensation may vary in the cost of that between different FMS agencies, but it should be a pass-through cost. The FMS shouldn't be marking up the workers' comp costs.
Or the wages or the taxes.
Right, exactly. Okay, so we have so many questions, and I'm going to try to answer some of that. Somebody said we need to do this again because there's so many questions and so little time. That has become very clear to me. I mean, this is the most questions we've ever been asked. So I'm thinking we do another one for self-determination participants and service coordinators. Maybe we do like a joint training with DDS and ARCA to try to get consistent, and the statewide advisory committee to get consistent information out there, because there's clearly,
Judy, I think you are frozen. Is it right?
Yeah, she was frozen.
She's frozen in time.
Okay.
Oh, wait,
What do we do without Judy?
I don't know.
Sorry, folks, from time to time this happens. Judy's internet has cut out in previous webinars. Hopefully she will return very briefly. I am texting her right now to make sure that she knows what's going on.
So Rick, we've got the mic.
Yeah, do you want to
That's
answer?
dangerous. That's dangerous.
Yeah, well, there's a whole lot to talk about, and we probably ought to do another one of these. But one of the things, as Judy was talking about workers' comp, people have a hard time deciding in many instances whether to choose the sole employer versus the co-employer model. And I think the important thing is to make sure that the FMS that you solicit, you interview them and you ask them the questions that need to be asked, which is, what's this really going to cost me? And you can compare it with what it might cost from or by another FMS. The other thing is, this workers' comp is a very important piece, because I've always believed that, and certainly the experience over the last 20 years is, in California, work comp rates are very high for personal care employees. And that's true throughout the country, but California is very high. And they can really bust a budget. Workers' comp insurance can bust a budget. And so there's two pieces to that. One is, Harvey explained that many insurance policies have workers' comp coverage, and sometimes there's a premium and sometimes there isn't. Right. We insure through our own policy, and there's a premium of $550 per person per year, which is substantially less than it would be at $12 or $14 an hour. Per 100 if we were to buy it on the open market. And so that's just another important area where where people must do some comparison shopping, because there's a limited budget and you've got to figure out how to spend your dollars. The other thing I wanted to mention, which is kind of related to this, is the overtime issue. What we have found is that If you can find or have an arrangement where you are not actually employing somebody 40 hours a week, and Judy alluded to it, if you employ a number of people 30 hours a week, and all of a sudden there's overtime required because somebody gets sick or somebody's child gets sick and they don't show up or somebody quits. There's any number of reasons why somebody is not going to show up for work. You can, in many instances, draw upon others who are working for you without going into overtime territory because they are at 40 hours and they would be up to 40 hours. So again, creativity, flexibility, and choice. Those are really the hallmarks, and you see it every day, every week, every month, and every year as life happens.
Rick, it's nothing like experience. You've got it. You've been down that road.
Hi,
I would
everybody.
also add briefly, Rick, that people also put in allowances, as Judy was suggesting earlier, for overtime. They put allowances in for training and supervisory time too. If you have a large staff, that sometimes is necessary.
Mm-hmm.
Yeah, exactly. And we were helped very, very, John, I mean, Carousel thought of things that we didn't, and overtime is a big thing here. Big. You know, it's hard to afford it.
Thank you, everybody, for staying on the webinar. I thought I kicked you all off by my internet going out, my brand new internet that we just purchased. Yay! Yay for AT&T to be as bad as Time Warner. So I'm sorry. Thank you all for answering that. I'm going to end this and try to get some of the answers out there to everybody. It's clear that people have a lot of questions and we need to do more training on this for everyone. So I want to thank all of our great panelists today, and we will have a recording of this webinar up on our website by tomorrow. So thank you all again, and I'm going to actually ask Ed to end the webinar since I'm no longer the host. Thank you all, everybody. Take care.
Thank